So we want to welcome everybody back to another Wednesday evening experience here at Miracle City. I am Pastor David B. Franklin, lead pastor here at Miracle City Church. We're so glad that you have joined. As you know, we always start this program by inviting you to invite somebody in. Come on, let's not keep this to ourselves. I know we are in time of quarantine, time of isolation, but this is a time we need to rely on one another even more than before. And each Wednesday, we're providing some practical, ready to use tips and steps that can provide some clarity during this crisis. So we need you to come on in, invite others in, send a text, repost the link that you see here on your page, and get involved in this conversation, because I am telling you, it's going to be phenomenal. Last week, we had Dr. Rita Walker, and if you didn't see that program, we need you to go back and watch that on our YouTube page, Facebook page. You can go to our website, miraclecitychurch.org, and you can see it there as well. And this week, we wanted to take the national conversation we've been having and ground it within a local context. And so I'm glad that we're able to do that today with two individuals who are well able to discuss how Baltimore City is responding. And we believe that as we discuss how Baltimore City is responding and some of the challenges and intricacies that are happening here in our city, you're going to find it useful on how you can respond to things happening in your own city if you're not here in the city of Baltimore. And so I'm so glad that we're able to have two individuals who are on the front lines. They are making an impact in ensuring that people stay safe, ensuring that folks get food, ensuring that testing is where it needs to be. And they are been so gracious to join us. So I want to introduce them to you right now. Our first guest is none other than a good friend of mine. He is the councilman for the district where our church sits, where our church facility sits, the 8th district here in the city of Baltimore, none other than City Councilman Kristerfer Burnett. Brother, Doctor, we're going to call you Doctor now. He's like, no, not Doctor. But Councilman Burnett, we're so glad to have you with us.
Thank you for the opportunity to speak and share what we're working on and help people get through this together.
Excellent. Excellent. Thank you for being here. And not only that, you know, we like to have more than one guest. And our next guest, she is on the front lines, been rocking it for years. She moved from being a pediatrician to being the health commissioner for the city of Baltimore. I'm so glad that she took time out of her busy schedule to join us. It is none other than Dr. Dzirasa. Doctor, thank you for being with us.
Pastor Franklin, thank you so much for having me. And Councilman Burnett, good to see you as always.
Good to see you as well. Thank you.
Excellent. So listen, let's just jump right into this conversation. Here in Maryland, confirmed cases are over 45,000 as far as I understand. And not only that, but we have over 2,000 deaths. And yet, as we see a spike, we know here in the state of Maryland, like many other states, we see that the reopen or the stay-at-home order has been lifted, at least for the state. And yet locales, cities, counties are making different decisions. Dr. Dzirasa, I'm going to go to you first. Well, what's the thinking behind Baltimore choosing to maintain this stay-at-home order, at least for now?
Yeah, that's a great question to begin with. If I can take a minute just to, at a high level, review some of our objectives in terms of how we are responding to this pandemic. One of our first objectives is to minimize the spread of COVID-19. So really focusing on how we can ensure that COVID-19, that we're stopping the spread, that we're identifying cases early, and that we're performing appropriate outreach to do contact tracing so that we can further minimize the spread of disease. Additionally, another objective is to protect our most vulnerable population, understanding that there are certain groups that are at higher risk. We saw when the racial and ethnicity data was revealed that there were disparities. How are we engaging individuals and groups that are at higher risk? That is a responsibility that we have and that we take seriously. And we've put appropriate measures in place to address those things effectively, like our triage, respite, and isolation hotel, which are unstably housed. Additionally, Another major objective for us is to protect our healthcare workers, understanding that they're on the front lines, ensuring that they have the appropriate personal protective equipment so that they can do their jobs effectively and care for those that are ill. Additionally, we want to protect our hospital from potential surge. So making sure, again, that our hospitals are well equipped and that they're able to coordinate transportation appropriately in the event of a surge. So those are our primary objectives. So when we think about reopening, and we at the local level have some control and some say over what gets open and how things are reopened, we're thinking about it with that lens. And some of our primary focus when we think about minimizing the spread is appropriate contact tracing. So again, as I mentioned, being able to identify residents early and understand who they were exposed to during the time that they were able to spread disease, and also doing outreach to those individuals, making sure that they have the appropriate information so that they can self-isolate and that they have the appropriate resources so that they can self-isolate safely. And then testing. So really, really expanding testing so that it's much more widely available than it has been since the start of the pandemic. And we've seen where we're increasing our ability to do testing. The city has 3 stationary testing sites that it supports that require an appointment. And we've also established 3 mobile testing sites that go to areas of greatest need and are low barrier, meaning residents don't have to have an appointment or a previous doctor's note. They can show up at that site and get tested. So those are really the 2 things that we're looking at, availability of testing and contact tracing. And as we're building those things up, how do we ensure that we can safely reopen when those appropriate measures are in place?
Yeah, no, so that's critical. That's critical. And so, Councilman Burnett, I want to come to you. And so how is that transferring down to this District 8, right? When we think about contact tracing, when we think about mobile testing availability, how are you interfacing with that reality to ensure District 8 is protected?
One, I work very closely with the health department. I'm the city council's representative on the Joint Information Center. So one, I've taken on a couple roles. One is in informing the communications that are going out to the public, making sure that everything that we're putting out is relevant to Baltimoreans, that will connect and it's both culturally relevant and Baltimore specific, and trying to make sure that we are reaching people where they are. And so been playing a role on that end, and just sort of, I am not a communications person. Don't make graphics or anything like that. However, I am connected to the community. And so I can look at things and say, look, maybe we should say it this way, or this could be a strategy for us to do outreach to hard to reach populations. So that's on one end is just sort of the citywide communication function. The other end is working with my local stakeholders, right? So I have your St. Agnes Hospital, I have 9 schools, I have 4 rec centers, a number of churches, church partners like yourself, making sure that we are doing weekly check-in calls with all my community association presidents, my faith leaders, my community school coordinators every single week to just keep them up to date on what's happening, and so that they can help me push information out to the district. And then the other piece of it is just making sure that we have the resources that we need. And so a lot of that is just sort of supporting community-based efforts to do food distribution, making sure that they have the logistical support from the city. So whether that's like assistance with parking cones and traffic coordination, or getting the National Guard involved if it's appropriate to do so. Reaching out to my own networks. One of the challenges that we have with distance learning in schools is kids don't have the technology. And so both one end advocating as a council member, we were able to pass a spending bill for $3 million to go to Baltimore City schools to help with their technology purchases, which very recently, because we know that as this continues, the digital divide becomes more apparent with kids who don't have the ability to learn from home and will likely fall behind. And so I've been reaching out to stakeholders, business owners, folks that I know who either contacted me directly, or I know who are people of influence that can help close that gap in District 8. And then just keeping my ear on the ground, right? If there are things that are popping up, I mean, we do have 4 senior facilities in my district, making sure that I'm doing outreach to them to see how they're doing. We've been calling seniors. I mean, it's been a lot. Like the adjustment to working remotely was a challenge at first, because as you know me very well, I'm much more of a hands-on person than I'd say your average elected official. I like to get out in the community. So that's been a difficult challenge. And my staff is very much similar in that way. They sort of adopted the similar culture of like, we get out, we get after it. And so the transition to working remotely has been a challenge, but I don't think we've lost a step at all in our ability to communicate out and coordinate resources and still doing the things that we were doing ahead. But I think with this pandemic, the most important piece is that information, right? How are we instructing people how to wear masks or where to get testing or where to get food, right? Like that has been the biggest hurdle, I would say, because as a city, I think we did a decent job before this, but we've been tested now with like how far can our message go? Who's paying attention? Who are our credible messengers on the street? Sometimes it's elected officials, sometimes it's a faith leader, sometimes it's knowing somebody on the block that, you know, is well respected, right? And I think that's where we've continued to try and be very nimble in our response. And it hasn't gone unnoticed. I've had other elected officials from across the country reach out to my office trying to figure out, well, wait, you guys are doing some really cool memes at the health department. Can you send us the template or like these graphics or the way that you're doing the town halls, like help us implement these. And that's really very humbling to have folks notice that the work that we're doing in Baltimore to keep people safe. And so I'd say that's sort of like what my life is like right now. As you can see, I'm home, but, you know, trying to keep myself safe and you know, getting out when I need to. But it's been quite a challenge, and also knowing that we have a ways to go. And so the weather changing, that's really shifted how we're working, because we know that the social distancing will become more difficult for people to do, and you know, and will be more difficult to keep people inside and not wanting to engage, because we know summertime is a great time to have a cookout or be out on the block or hanging out at the harbor, and so it's been tough. And to your earlier point about you know, the state giving one message and the local municipality doing something different has also been difficult, especially over the last few days, because people really do want to get outside and eat and go back to some level of normalcy. And so it's been difficult to sort of help people understand, like, look, this may not be that summer, right? We may have to give a summer or two up in order to make sure that we're all safe through this.
Yeah, and you know, on the end there, you said a summer or two, right? Which is that's a reality that I don't think that many of us are. I don't think that many of us have fully embraced that as a real possibility. That we're going to be living with this thing for a while before we have some real sense of control on this virus. So I want to go kind of use that to kind of launch off into the next, you know, topic here. What do you want people to do, right? People who are at home, you guys are on the front lines. You've mentioned multiple things that you're trying to do. I want to come back to testing and contact tracing and where the city stands with that at the moment. I want to come back with that and kind of see where the goals are and all of that. But how do you want people to respond right now, like tomorrow, right? How do you want people to be conducting their themselves during this specific time in the crisis? And Dr. Dzirasa, I'm going to go to you.
Well, Pastor Franklin and Councilman Burnett, I think you guys made a great point that this is going to go on for a number of months, right? We're probably at the very beginning, and we do have to get to a point where we eventually have a safe vaccine and have done some level of mass vaccination. I think before we return to complete normalcy. So I think first it's kind of level setting that as an expectation that for the foreseeable months, there'll be probably some recommendation for some form of social distancing and recommendations for some levels of restriction, you know, of maybe large gatherings. So I think, you know, putting that out there, it just so people are kind of aware. I think also the setting the expectation that we could see a resurgence, so we can see where cases could go up again in the fall, and what does that mean in terms of restrictions? If we've you know, lightened things up at that point, what does it look like to potentially have to backtrack in some ways? So I think just keeping that in mind, and I know that's hard if you're not in this day to day to kind of grapple. But I do want to at least put that out there. You know, I would say it's still important that we stay home if we have the ability to stay home safely, and that we really focus on going out for essential reasons, so that we don't place, you know, even if you're a healthy individual, you don't place others in your life at risk. If you have older adults in your home or others in your home with underlying health conditions, to really take those precautions of going out, you know, really for those essential reasons, you know, going out with your face mask, your cloth face covering, doing as well to stay as safe as possible. Continuing the hand hygiene so that also doesn't go away. That would really be my main advice.
And what about this, the testing, right? So we've talked about this mobile testing, and we've talked about, I got a text from a friend this morning giving me the sites where you can get tested without a doctor's order in multiple locations, not just here in the city, but even in other cities in Maryland. How do people access that? Should anyone and everyone be going to advantage themselves of that opportunity? Speak to that.
Good question. So I will just kind of highlight that we do now have a map up with testing locations in the city. If you go to our website, coronavirus.baltimorecity.gov, and it breaks it down based on whether it's a hospital-based location, a community testing site, or a mobile neighborhood testing site. So please feel free to check that out. You can find the map on our website. As far as who should get tested, originally, obviously, when tests were extremely limited, and I won't say that they're in most abundant supply now, but it's certainly much better than it was, a few weeks ago. We did have pretty strict criteria on who should get tested, and it was very much focused on people who were symptomatic and had underlying health issues, and or individuals who were in the hospital and symptomatic, or healthcare workers who were symptomatic. We've subsequently seen where the state has loosened restrictions to allow more discretion at the local provider level, at the local health department level. And what I would say, certainly if you're at risk because of exposure, maybe you work in a congregate facility such as a homeless shelter, or you work at a nursing facility and there's concern. And again, the governor mandated for all nursing facility residents and staff to get tested. Then again, if you're deemed as maybe a part of an outbreak, or again, as a part of an exposure, someone from the health department or your primary physician may say that, you should receive a test. So it isn't just limited to maybe those people who have the comorbid conditions. It could be a person, who's relatively healthy, but is experiencing symptoms. And now that there's more widespread testing, your physician could make that recommendation on your behalf and have the test done for you.
But should I be going to one where I don't need a doctor's referral, right?
So I'm going to say, so that's a good question. So I again, testing it's much more ample than it was a few weeks ago. But still, we also want to focus on people who are highest need and highest risk, right? So if you've had no symptoms, if you're following all the stay-at-home orders, but you just want to know, I don't know if I wouldn't necessarily.
You're not encouraging that.
I'm not encouraging that. Really, again, but if you're a person who, you, because of where you work, you ride the bus every day, and you're experiencing maybe mild symptoms, right? There was a time where we probably wouldn't have tested those individuals, but now that there's more ample testing, if you call your provider, that person may refer you. At our sites without appointments, there is still a screening process, and it's not to say that they turn people away, but there is still an evaluation of, are you experiencing symptoms and those types of things, so that they can advise you appropriately.
Got you. And Councilman Burnett, I know you said you've been staying at home, and I know that's true. And you also said you like to get out there. And so I saw you actually giving out masks in our community, which I thought was absolutely awesome. When you have been out, what concerns you about the way you see folks interacting, and what kind of gives you some hope that folks are getting the message?
So a couple things come to mind immediately. So people aren't social distancing as much as I'd like, which is the areas that we picked were very strategic for that reason. They're areas that we've gotten calls about where large groups are still gathering, people are hanging out. Some maybe in the pharmaceutical trade, the non-legal trade there, say that politely. So we've been trying to actually target those areas because we know that those individuals are one, probably the highest at risk because they are engaging with a tremendous amount of people that are coming from all over the region to purchase their products. Two, they are probably not watching the news every night or following the health department's Facebook page for updates. These are just things that we know, right, are just least likely to be getting the message and are incredibly high risk to spread it. And so we targeted the corridors where we know there are businesses that are legitimate and some illegitimate operations that people may not be getting the message out. And so that's why we targeted where we targeted. I'd say it was kind of controversial. It wasn't just in my district, but a couple of my colleagues were upset because they did see guys who they presumed to be drug dealers wearing gloves and masks while still selling drugs, which was kind of encouraging because I'm like, all right, they've heard something correctly, right? They may not be, as concerned about cross-contamination or wearing a different mask every day. I mean, there's still additional education that needs to be had. And I'd applaud the health department for developing materials that sort of speak to that. So we were also, in addition to handing out masks, I wish I had one here. I didn't know you were going to ask this question, but I had a couple in my car that are like, don't dab, don't smoke, don't share your alcohol with other people. But it's written in a way that, like, when I first saw the flyer, I was like, there's no way the health department actually made this one. They actually did. I thought it was someone else, and I was like, oh, this is like great marketing, but it was very relevant, right? And so handing those out, people were like, oh, this is dope. Like, I didn't even think about that. Like, I didn't, maybe pass them around something to share with a group of people, and I need to be more mindful of that. Sorry, I'm trying to be appropriate to your audience, but this is what I found when I went out.
Listen, no, this is great.
Because a lot of folks that are hearing the message, that are trying to follow the guidelines and to the T, aren't going to be out hanging out on the block, right? So we know that it's sort of a different message, but it's getting out, even if it's a little bit. But a couple of things I would still note that we did have to explain to people, which one, like how to wear the mask, like keeping it at your chin while you still talk to people is still a thing that I think, all right, I'm glad you're taking the first step, you're wearing the face covering, you're wearing the mask, but you still need to talk through it. And, it's a weird kind of cultural vibe that I think we need to go over, because I've had some people literally say, like, I'm uncomfortable talking to you. Like, it doesn't feel as personal talking with a mask on my face. And so they pull it down a little bit. And, I think that is like sort of the next step is like, we're this level of discomfort that we're all experiencing, the lack of normalcy that we're all experiencing. We're just going to have to get through it. There is no way around it. Yeah. We have to go through the tunnel. I am hopeful there's a light at the end of it. And just trying to get that message that there's going to be a lot of sacrifice that all of us have to make, whether that be our social interactions, the things that we would normally do in the summer months. My wife loves to travel. I love to travel. We're not getting on planes right now. And, it's very different. And, helping people know that even if you do want to hang out in the park, or you do want to hang out in the corner, just like space yourself apart. No one's saying don't be social, right? We're, as human beings, we're social beings, right? This is how God created us. And this is who we are. But with this type of virus, that is like the worst kind of behavior, right? And I think for most people, that transition is very difficult, because it's like who we are as people is like we like to be around each other. I miss my family. I miss being able to hang out with my aunties and my cousins, and missing birthdays. And I'm about to have I'm about to be an uncle in the coming days, right? I won't be at the hospital, so something that's going to be just different. And so I've tried to take it all in. I have done some outreach with the food distribution events and the mask, but even then I'm like making sure that I'm keeping good hand hygiene, keeping my, fresh mask on, not cross-contaminating gloves. Like, I'm trying to do everything that I'm telling people they should be doing. But, it is difficult because, as a government official, there's some lack of credibility that you have. So I did have some people that wouldn't take the mask because I had this like Baltimore City t-shirt on. So I was like, the next time I went out, I had like a Lamar Jackson jersey on. So I'd like, actually got a better response than like wearing something official. And so there's the other piece of it is like understanding that there is a distrust in government, which goes beyond anything, that specific to Baltimore City, just the national conversation, the local conversation, I don't want to go down that rabbit hole, but like, that's a real thing. And so where the message is coming from and who is delivering it is also a critical piece, because some people absolutely trust something that Chris Burnett says. And there's some folks that are like, nah, bro, literally, I don't want that mask from you because you're a government official.
That's right.
And so making sure that I'm also recruiting other people in the district that I know do have that credibility to also help support the work.
Yeah, so you said you don't want to go down that, but that's something I wanted to ask. Go down that path. Yeah, no, not at all. Because I think one of the reasons why we're seeing increased numbers in African-American communities in particular is because we have these inequities that are exasperated during a time of crisis. And it's like, well, who do I really trust to listen to, right? And as we are seeing with situations like George Floyd, Breonna Taylor, Ahmaud Arbery, is that it's there is a reason that folks on the block distrust the institutions that are supposedly supposed to serve and protect, right? Yeah. So I love I haven't seen this flyer about don't share your alcohol or don't, you know what I mean? I haven't seen the flyer, but I don't want none of my members emailing me that's saying that I love the flyer. I love the fact that the information is getting to the people who needs to get to. So what other things can be done or are being done to make sure that we reach what I'm going to include in the at-risk population, right? We've been talking about 65 and up and pre-existing conditions. We don't talk as often about those communities that are already oppressed or are already disenfranchised, and how ensuring that they're protected during this crisis is a whole work in and of itself. So I would love to talk a little bit more about that and what even the city may be doing in addition to the flyer to trying to get the information to all segments of Baltimore City.
Yeah, I mean, I think one thing I'll echo what Councilman Burnett say. I think that the flyer was a very creative way to reach a population that we wouldn't reach maybe on social media. And I think that the city isn't doing this work alone. I've heard of very creative messaging coming from the NAACP, where they are going around literally blasting the message from a speaker from a car. I've appreciated partnerships from 92Q and radio stations that are also kind of sharing that same message that, to your point, may not traditionally reach this population in a voice that's perhaps more trusted than mine or Councilman Burnett. So I think certainly messaging is a crucial part of it. I think at the health department, we also look a lot at the data. So really examining the disparities that we're seeing that, to your point, are just exacerbated by this pandemic. They're disparities that already existed, but we're certainly seeing how they play out in this pandemic. And as we're examining the data, making sure that the healthcare partners that we work with are also aware so that they can make appropriate interventions, right? So we have a weekly call with all of the hospital CEOs, and we share the data with them. We want them to understand that there are disparities in the African-American community. It was actually some of our hospital partners who began to notice some of the disparities in the Latinx community because they were seeing them show up in their hospitals. And so as they noticed it and we dug more and we were able to get more access to ethnicity data, we were able to work with our hospital partners who are already very plugged into that particular community, and say, like, you're seeing the need, we're seeing things show up in our data. How do we come together? And in this instance, we stood up the mobile testing site in the 21224 zip code. So it's trying to use that data along with hospital and healthcare partners to appropriately target. In addition to talking to our hospital partners, we also have a weekly call with our federally qualified health centers. So again, these are the healthcare partners that are also very much on the front line. Some of them were doing some limited testing. They got recently funded to do additional testing. So working with them so that they know the communities, again, that are most in need. So we have the data, and then they have some of the resources to actually go and do some similar mobile community testing like what we're doing to identify those residents. And as I mentioned, the city supported standing up this triage, respite, and isolation hotel that will house unstably housed residents, such as those in our homeless population, but also maybe those that are in multi-generational households or undocumented workers where it's not safe to go home because there are so many people in your home if you're positive. So that's been set up now a little over 2 weeks. We've seen 81 total residents come through. Right now, the census is sitting right around 35 people.
Excellent. And Councilman Burnett, resident to resident, what are the opportunities there to get this message out? Like, what do you want to see? So you talked to a few residents while you were out in the community, and you were maybe able to engage a few. What can residents be doing to ensure that other residents are appropriately taking the necessary steps to keep themselves safe?
So I think word of mouth is the best thing, right? We have engaged, as Dr. Dzirasa said, community-based partners like the NAACP, community-based organizations to put signage up in like corner stores and liquor stores and all the shops that have been slowly opening. I know I went to every single one of them in my district and put up signage and talked to folks in addition to the PPE outreach. But that word of mouth, is the best thing, right? So making sure that if they are on social media, that they're following the health department's page, which has a tremendous amount of resources that are posted several times per day, at least 4 to 5 times, there's new information being posted, making sure that they're sharing that information on their social media feeds. And if they are checking in, doing Zoom calls, talking to family members, having small gatherings of 6 people or less, that even in those spaces are, saying, hey, making sure that you're wearing a mask, or this is where the testing sites are. If you're not, just making sure that people are educating ourselves on what to look out for, and where the resources are and how to get to them. And I'd say the health department has been great at like elevating the social media presence, which we know not everyone has, but a lot of people do, right? I did, because, there's, I heard that a lot, that, there's too much of a focus on social media. Not everyone uses it, but like 80% of the households in Baltimore are on Facebook from the data I pulled up. Because I was like, I don't know about this. Like, you may not have, Comcast or Verizon's highest internet Wi-Fi at your house, but you probably do have a phone. And that's where most people are getting information from. And so just making sure that you don't keep it to yourself, that you're sharing with neighbors, sharing with friends, sharing with family members, reaching out to older adults who may be, as the doctor said, in congregate living facilities, whether that be nursing homes or just senior housing, to make sure that they're getting the message. Because if there was a population least likely to be on social media, it would be our older community. And so, I know that we've tried to do a combination of print media outreach, social media outreach, NAACP and others literally driving through neighborhoods, blasting information out into the community itself. And even to that point about credible messengers, we've gotten a much better response from the NAACP doing it than we did with the police department doing it. And so I think it spoke to that piece as well. I've had people reach out saying, hey, how do I get the NAACP to come to my neighborhood? I'd say that's where, there's a lot of channels. We are being bombarded with a lot of information, but I think the real basics are, making sure that they're staying home, not large groups, going out when necessary. And again, I know that it'll be much more difficult in the summer months. So if there was a time more than now than ever, it's right now that people need to be making sure that they're holding each other accountable, right? Like it has been hard for me and my mom to not come over and hang out with us. Like she's just like, why? But she has underlying conditions. And I'm like, look, I don't want to get you sick. I feel like I'd be okay. I don't know. I don't think I've contracted it. I haven't been tested. So I'm with you. I'm glad you asked that question, because I was like, maybe I could drive out there and just see what's going on. But I've been trying to be mindful of that. I went to go see two of my great aunts and mow their lawn the other day. And I made them talk to me from the porch, even though, of course, her reaction was like, bring you in the house and feed me. And I'm like, I'm not coming in that house. There's no way you're getting me in the house. You can talk to me through the window, right? And that's tough. Like, it's my auntie. I love her to death. Like, yeah. But I didn't want that interaction to be something that could escalate further. And I think that's where we as individuals can play the part. Not only we need to be living these things ourselves, but making sure that we're communicating and holding each other accountable as well.
No, that's critical. And mama wants to, be, folks have, this is a real thing, right? We've done 3 different segments on mental health, right? And how isolation can even be toxic to your system. And, there's this whole thing. We won't jump into that now, but, even as folks begin to look at summer and, trying to get back to some sense of normalcy, I've been telling folks, don't think you're going back to, we just need to plan on a new normal, right? Because, we're not going back to what was. But there's that real thing, that loss of connection does something to us. And so we're trying to find ways to recapture it again. And it really is hard to, over sustained periods, to continue to put in some of these practices. But the fact is, if we don't, it could literally cost lives. So we got to keep doing that. Dr. Dzirasa, I want to go back to testing just for a second. I think people want to know, what's the tipping point? Like, when do we know that we've got enough testing, enough contact tracing? Is it that and waiting for a vaccine, or is there a tipping point when we get to testing and contact tracing? Things will change. Give us some sense on what we can expect.
Sure. So what I think we can expect is some of what we've seen, right? That there will be phases of reopening, and there will be local officials as well as federal and state officials looking at, given the information data we have now, what is maybe something that's safe to reopen. So there will be kind of these different steps that we're able to take. So for instance, the step to outdoor dining with social distancing, as opposed to going full throttle, opening up restaurants at full capacity, right?
Mm-hmm.
Like, I think we'll see this happen stepwise throughout the summer. And we'll be evaluating, different types of services, right? There are some services that are, much higher risk, right? We know that outdoor activities generally are safer. Like if you're in an open space, it allows for better social distancing. Obviously, you still want to wear your mask and keep your 6 feet. Then if you're in an enclosed space, it's more challenging. Likewise, we know that large gatherings, right, there are more touch points. Infection in a large setting versus if it's a smaller group. So I think we'll see this kind of happen stepwise. Now, the city actually looked at the World Health Organization's recommendation as far as the amount of tests that would be considered adequate. That combined with our positivity rate. So really the percentage of people that are testing positive on an ongoing basis. So based on the World Health Organization, that number was between about 2,700 and 2,800 tests a day. What we've seen in this past week, where we have the most complete data, we averaged just a little bit under 1,000. And that's not necessarily there, but it's actually double the average we had at the beginning of May. So we're really seeing this, significant ramping up of testing. But there's still obviously more work to be done. Additionally, we're seeing an improvement in our overall positivity rate. So we're seeing we're starting to have more widespread testing, and so you're going to get more negative tests, which is actually a good thing because it lets us know that we're testing enough people, that we're coming across people who aren't that don't have the disease.
Mm-hmm.
That said, we still want to make sure we're focusing on those vulnerable communities where testing may not be as available. But those two things together are certainly what the city is looking at in terms of making decisions on reopening in a phased way.
And if I recall, and if I'm wrong, I want you to correct me, that the positivity rate that folks are going after is like around 13%. Is that?
So ideally less than 10%. So the World Health Organization said about 3 to 12%. So in countries that did a really good job of controlling the pandemic, they had, I think South Korea's was like 3%. Like they had very, very low positivity rates because, again, they just did very widespread testing.
Gotcha. So right now, our positivity rate, do you know the percentage at the moment?
It's about a little over 17%. It's right around there. But last week it was around 21%. So again, we're making strides.
And have doubled the average testing since the beginning of May. Phenomenal. So we will continue to go, and then the goal is to reach that 22,000.
That's the goal, but again, I'll say there's going to be it's a phased approach, right? So it's not all or nothing, right? Like I think what we'll see, again, we're seeing our positivity rate improve, we're seeing our testing become more available. So as we see that, we consider how we can reopen certain activities safely, still being mindful of social distancing, and of course wearing our cloth face covering.
Excellent. And I got to go back to this because you've mentioned gatherings twice, and I need you to help me with the members in my congregation. And you just said large gatherings. So
I did.
Let's talk about church for a second.
I knew it was going to come up. So again, I mean, in all honesty, we're evaluating the data regularly. We realize how challenging it can be, not just the social isolation in general, but being away from your church family that might provide a level of support, and certainly missing seeing them every week. So we have, we are continuing what has already been put out there, which is really the gatherings outside from the car to maintain that social distancing. So I don't have a timeline for you, but know that it's on our radar. Know that we look at the data regularly to make those tough decisions.
All right. I want you to hear it, Mama. I want you to hear it. All right. I want you to hear it. Sister, I need you to hear it. Brother, I need you to hear it. All right. This is from the Baltimore's health commissioner. We are churches should still, unless it's drive-in. Which for us, we have said that, I mean, once you start thinking about bathroom accommodations and those kinds of things, even drive-in is not feasible for us. So we're staying virtual. The city has put a timeline on, or at least when the stay-at-home order is in effect until. Is that right? Or is it?
No, I don't think we have. No, we haven't. Okay. It's more, again, we're looking at it on an ongoing basis.
Got it. All right. Well, you guys heard it here. So, don't think it's past there, right? We're trying to stay in congruence with our city officials. Councilman Burnett, locally, we have businesses. We have entities that are not being able to function as normal. What would you say in terms of how we can continue to make sure that our communities thrive or are able to recover even after, since they're not able to operate the way that they would normally operate when, prior to this pandemic?
Yeah, so that's been a tough part. I've been trying to communicate as best I can with the food service businesses in my district, places that I know are already operating at very small margins. And one, I'd say making sure that you're trying to support, even if it's just getting takeout. Me and my wife always have a Friday night date night, and we've kept to that. So I'll be picking up the food tonight after we're done this call, actually. We try to support local businesses, places that we know are really did a great job, at least from my perspective, at being very community focused businesses, and making sure that I'm spending some money there, even if it's just popping in, taking it to go, or curbside pickup. And the same, there have been some relaxing of regulations on a number of different types of businesses just this week, actually, that you can do curbside for. So it's a lot more retail options now, which I think is a good thing, because a lot of those businesses, I mean, they were, on a very small margin already, and this did not help. And Baltimore was already struggling to keep businesses, just given the levels of violence that we have and other challenges with the opioid crisis and housing and all the things that we're working on every day to try and fix. Has not been very easy for a thriving business community and then this on top of it has made it difficult. So, making sure that you're still going out and supporting those local shops. If you are picking up groceries, if there's a small corner place that you can go to, and I'm not saying don't go to the corporate places, because I have some of those in my district too, but if there are ways that you can support small businesses and getting some things here, some things there, to spread that money around and try and keep our economy up. Because, as much as the focus has been on, the impact of business owners, these places employ people from our communities. And so making sure that they have a job to return to means that we need to continue to support these places and do it safely, obviously. And, and making sure that's communicated out too, that, if you go into a business and they aren't enforcing wearing face coverings or social distancing, making sure that you mention that to the store owner that, hey, look, I want to keep supporting you, but I need to make sure that I'm safe and that the other people here are safe as well. And or if they're just bucking, which we've had some businesses that just are not trying to comply, making sure that information is reported to the health department. You can call 311 or 911, depending on the type of complaint that they like to lodge, but making sure that we know where people may not be in full compliance and keeping people safe, because as much as we need to support these small businesses and during this time, making sure that we're also holding them accountable if they do have a physical storefront, but also just helping other ways, right? Maybe there's, they have a digital operation, or just trying to make sure that we are still keeping things going and keeping the economy thriving while making sure that we're also safe, which has been very difficult, because the national narrative, in my opinion, this is 100% my opinion, has been a lot of focus on the economy itself and not really the people. And this is more of a commentary on the national news and what's coming out of the White House. And, I think we do need to strike a balance where people are safe, where our communities are safe, but that they do have a job to look forward to on the way out of this. And so if you do have to leave out, make sure that you support somewhere local in your community, preferably, is what I would tell people.
Yeah. All right. Well, listen, our time is almost done. Dr. Dzirasa, I want to give you one more chance to, this issue has become politicized, unfortunately. There are still some people who believe this is a hoax, or that this virus is not as serious as at least I'll say I believe that it is, and as I believe the data suggests that it is. I want to give you one more chance to get some of those folks on board with believing that this thing is real and that we need to do all in our power in order to limit its spread. And I want to give you that opportunity right now.
Oh, thank you, Pastor Franklin. I think you raise a good point that there continue to be a lot of myths and misconceptions about this disease. So I'll actually tell a story about, I was on a telephone town hall last night, as a matter of fact. And one of the questions that one of the callers raised was that if I'm sick, should I go to the hospital? And she rattled off several friends and family members who had gone to the hospital for COVID-19 and died. She was afraid to actually go to the hospital. She told her story of how she actually contracted it and she came out okay, but rattled off multiple family members that did not. And so what I would say is that this is very real. And to what we've talked about earlier, it's impacting communities of color disproportionately. And so if there's anything that we can do, we can each make the choice to socially distance, right? You may not be able to choose whether or not you can go to work, but if you're an essential worker and have to go, try to maintain that 6 feet. Wear your cloth face covering. It can be an old bandana or a scarf you have around your home. It doesn't have to be fancy. Just try to protect yourself and those around you.
And for the individual who is not sick, so isn't concerned, and Kristerfer, Burnett, Councilman Burnett, you mentioned this earlier about, hey, I'm not letting mama come in my house, or I'm not going in auntie's house because I could have unknowingly contracted the virus and be asymptomatic and give it to them. And then because they're older or because they have pre-existing conditions, it becomes a very serious thing in their lives. So talk to the person who is not sick and may have a better chance of fighting off the virus, and talk to them about their responsibility in this fight as well.
Yeah, I mean, I think for me, it's also a little personal. I lost my grandmother last summer, and she had a long fight with, she had a lung transplant and had really long fight with breathing related issues. And sort of reflecting all of this, I was talking to my mom about this the other day, actually, and I was like, I would be on pins and needles right now. I mean, I obviously did not ever want her to go, but I am so thankful that when she did transition was before all this happened. And because, we were around each other a lot, we talked a lot. I was always over her house. We talked, she loved talking politics. She loved my work and, held me accountable when she felt like I didn't vote the way I should have voted, that kind of thing. And, but her sisters are still in the same house. And so for me, it's just like, it would kill me, not literally, but like to know that like my reckless behavior led to them becoming ill and potentially losing them, knowing that they have very serious underlying conditions as well. And that, in this time where I view my role as supporting them. So I do call and check in. Do you need me to pick something up so I can leave it on the porch for you? Do you need me to come and cut the grass for you? Do you need me to move the trash cans? Like whatever you need me to do, I still want to do it. I still get the interaction of like being more than 10 feet away from the porch talking. But like, for me, it would be crushing to know that like someone that's relatively young, healthy, I don't normally get sick, which is, been a blessing that I'm not the kind of person that has a lot of underlying issues. But it sort of fits that exact profile that health professionals are talking about, that like younger people who don't have underlying things may still contract it, but may not show symptoms, but you can still spread it, right? And I think that's the important piece, is that we care about our family, we care about our friends. And one of the ways that we can show them that we care about them and that we love them is by engaging in all the recommendations, right? That is the best showing of love, right? It's not easy to say, Mama, like, you can't come in my house. I'm a double mask up and meet you at the car and run back up the steps, that kind of thing, right? But that's showing my love for her. And that's what I would communicate, is that like, this is a time that we can show our love for each other more than we ever could in the past, by being responsible and by being careful with each other, so that when this is done, when we're out of this and whatever that new normal looks like, we're all still here together. We still have our health and our family. And, we can, even if you just look at the data, right? Like a week in one way or the other, a week late in shutting down the city led to a certain outcome, right? And the same applies to our personal lives, that one more time that you had to go over there or you didn't wear a mask could be that time that you may reflect back and say, man, like, that might have been it, and I was a part of that. And I don't want to like take us off, down, a really sad thing, but like that's how I've been sort of processing it myself, because I have a very close-knit family. We do get together quarterly. We celebrate birthdays together, like very tight. And so it's been really difficult for all of us. But I do have parents that are frontline workers. My dad is an EMT. Like, so, again, like I need to show my love for him and the work he's doing. I'm making sure I'm washing my hands, I'm wearing gloves, I got my face mask on, I'm doing all the things, hand sanitizing like crazy, my hands are dry, but doing all the things is how I'm trying to do my part, and that's what I would tell people.
Yeah. Gray hands are okay during this time, right?
We're done with this, right? We'll be fine.
That's right. I'll take some ashy hands if I can save my loved ones, right? So, yeah, listen, this has been a great conversation. I appreciate you all taking time out of your busy schedules. You all, both of you should be applauded for the work that you're doing and your continued effort to make sure that, and I hope people heard it, that all communities within the city of Baltimore are cared for equally. And I just think that is laudable. And we're glad to have you all in these positions and working on our behalf. And again, thank you for taking some time today.
Thank you.
Excellent. Well, you have heard it here. It is Dr. Dzirasa, the Baltimore Health Commissioner, and Councilman Kristerfer Burnett of District 8. They have shared with us I believe critical information that will help us guide or navigate through this process and through this pandemic in a more effective and safe way. So please do not take this thing for granted. It is not something to be played with. It is very real. Let's not let the politics contaminate our practice. Let's do the best that we can to make sure we're keeping ourselves and our loved ones safe. So again, every Wednesday night at 7 p.m., we are here making sure that we provide clarity in the midst of the crisis so that as we walk together through this, we'll come out stronger than we started. If you want to partner with us in any way, you can always go to miraclecitychurch.org/give, and so we can continue to do the work that we're doing. And then we want to invite you to join us on Saturdays at 12 for our weekly virtual worship experiences. Well, may God bless you, may God keep you, and continue to stay safe and healthy during this crisis.
Prophesy. 'Cause miracles happen when you move. Healing is coming in this room. Miracles happen when you move. Heaven is coming. Oh, sing miracles. Miracles happen when you move. Set our hearts on you. Come and do what you do. We need oh, we need we need we need oh, we need we need. And we prophesy that this is oh, oh, this is oh, this is oh, this is